regarding the brachial plexus. Now, brachial plexus is usually asked as a long question. It is a long question, and whenever it is asked, we have to tell it under all these headings. We have to tell the formation, what is how the formation is there from roots, the trunk is formed, then divisions are there, cord formation is there, and finally the branches which are coming from the brachial plexus along with their root values. After describing this, we have to describe the applied aspect of the brachial plexus. If there is injury to the brachial plexus, it may lead to either the Erb's palsy, and it may also lead to Klumpke's palsy, and we have to describe those both palsy in this long question. Apart from this long question, a short note can be asked from the brachial plexus, and the short note can be on these palsies. Either the Erb's or the Klumpke can be asked, and in this we have to solely discuss about these palsies, that what is happening in this palsy, what is the cause, and what is the deformity which will be present in this in these palsy. So now we will discuss the brachial plexus. First of all, when we talk about the brachial plexus, the headings we have already talked about, and we will be answering the question according to the headings. You have to go one by one. First you will tell the formation, then how the complete formation is occurring, and then after that we will discuss about the branches which are coming, the various branches from the brachial plexus. So it should be in order. So first of all, the formation. The formation of the brachial plexus is from ventral rami of C5 to T1 spinal nerves. Now in this ventral rami word is important, because only the ventral rami is the one which is contributing into the formation of the brachial plexus. So this is a complete term which we use. Now during this formation, it can be prefixed or post-fixed. We say it is prefixed if it is getting a large contribution from C4. So we say a large contribution from C4. In that case, contribution from T1 is less or it is absent. So that is prefixed. Postfixed is there is a large contribution from T2 and contribution from C5 is absent. So that is postfixed. In prefixed, we can therefore say it will be from C4 to C7. And in post-fixed, it will be from C6 to T2. Now after the formation, the various components. The various components of the brachial plexus is during its formation, we will just write that first of all, the ventral rami, also termed as the roots of the spinal nerve, are present. Then these roots, it lead to the formation of the trunk. The trunk, they divide into divisions, the anterior and the posterior divisions. Then later on it leads to the formation of cords, and these cords, they finally give out the final branches to the upper limb, which will be supplying the various structures and the muscles of the upper limb. So these are the components. Over here, the root and the trunk, it lies in neck. It is present in neck, and to be more specific, it is present in the posterior triangle of the neck. So because it is present in the posterior triangle of the neck, we say it is above the clavicle, or the position is supraclavicular position. The divisions, they are present behind the clavicle, and this level, that is the cord formation and the branches, they are below the clavicle, and to be more specific, in the axilla. So these are the locations of these different components of the brachial plexus. Now how this brachial plexus is formed? So first of all, we have already said that the roots are there, and roots will be C5, C6, C7. Over here please write C8. C5, C6, C7, C8 and T1. These are the roots, and they will combine to form trunk. The C5 and C6, it combines to form the upper trunk. This is the upper trunk. C8 and T1 it combines to form the middle trunk, and C7 C8 and T1 it is forming the lower trunk, and C7 it continues as the middle trunk. So when we are writing the theory in the formation of the brachial plexus, we can just mention that the trunk we are having upper, middle and the lower trunk. The upper trunk is formed by the union of C5 and C6, middle is by the continuation of C7, and the lower is formed by the union of C8 and T1. Now after the formation of the trunk, the next level is it will divide into anterior and the posterior divisions. We will just show in different color. If this is the anterior division, I will just write A over here. This is anterior division. This is also anterior division of the rest of the trunks. The posterior division I am showing in red color and writing P over there. This is the posterior division, anterior and the posterior divisions. So for the division you can just mention, when we talk about the division, that each trunk it divides into anterior and posterior divisions. It divides into anterior and posterior divisions. Now we come to the formation of the cords. So next is the formation of the cords. Now over here, the anterior division of upper trunk and the anterior division of the middle trunk, they both unite to form the lateral cord. The anterior division of the lower trunk, it continues as such to form the medial cord. The posterior divisions of all, this is the posterior division of upper, middle and the lower one, they all combine to form the posterior cord. So this is how the cord formation is occurring, and when we are writing, we should mention that how this formation is occurring. The lateral cord, it is formed by the union of anterior division of upper and middle trunk, then the medial cord, it is formed by the anterior division of lower trunk, the anterior division of the lower trunk, and when we say the posterior cord, it is formed by the posterior division of all. The posterior divisions of upper as well as the middle and the lower. Now we come back over here. Now these cords will lead to the formation of the branches. You are having various branches, and these branches can be remembered with the help of the mnemonics. For example, for the lateral cord we have the mnemonic LML. For the medial cord we can remember it with the mnemonic M4U, and for the posterior cord various mnemonics are there. It can be remembered with a mnemonic star. So now here we have talked about the formation of the brachial plexus. Next we will talk about the branches. The branches of the brachial plexus. Now when we talk about these branches of brachial plexus, we come back to this picture. We have seen that the cord is giving the final branches. Apart from this, The branches are also arising directly from the roots and also rising from the trunk. If we talk about the roots, there is a branch which directly arises from the roots. This branch which I have shown over here is the dorsal scapular nerve with the root value C5. So I will just write the initials over here, dorsal scapular. Another nerve arising from the roots is from C5, C6 and C7, and it leads to the formation of long thoracic nerve. So these two nerves, they are arising directly from the roots. Apart from this, there are nerves which arise from the trunk, and to be more specific, from the upper trunk. These nerves are nerve 2 subclavius and the suprascapular nerve. And we can very well see the root value for this will be C5 and C6. So regarding the branches of the brachial plexus, first of all we will enumerate the branches directly from roots. In this, first is the dorsal scapular nerve. Now this dorsal scapular nerve, the root value of dorsal scapular nerve is C5, and when we are writing these branches, we have to write the root values of this. Along with that, we can supplement the answer with telling that this nerve is supplying which muscles. So when we talk about the dorsal scapular nerve, it supplies the rhomboids major and minor. The rhomboids major and minor, and along with that it is also supplying levator scapulae. The levator scapulae muscle. So all these three muscles, these are being supplied by the dorsal scapular nerve. Second nerve which is arising from the roots is long thoracic nerve. The root value is C5, C6 and C7, and this muscle is supplying the serratus anterior. Next we come to the branches arising from trunk. We have already said there are two branches arising from the trunk, nerve 2 subclavius and suprascapular nerve. Now the root value of both these nerves is C5 and C6 because both are arising from upper trunk. And if we talk about the nerve supply, it is supplying which muscle? The nerve 2 subclavius, as the name suggests, it supplies the subclavius muscle. The suprascapular nerve, it supplies the supraspinatus and infraspinatus. Now we come to the branches which are from the three cords. So one by one we will go from one cord to the another. First of all, the branches of lateral cord. Now the mnemonic we have already told, the mnemonic is LML. So that means there are three branches from this lateral cord. L is lateral pectoral nerve. Then the second L is musculocutaneous nerve. Then we have lateral root of median nerve. Now the root value of all these three branches, all are having the root value C5, C6 and C7. If we talk about the muscles being supplied by this, the lateral pectoral nerve, it supplies the pectoralis major. The musculocutaneous nerve, it supplies the muscles of anterior compartment of arm. That means it supplies biceps, brachii, brachialis and coracobrachialis. When we talk about the lateral root of the median nerve, it combines with the medial root of the median nerve to form median nerve. Now we come to the next cord, branches of medial cord. The mnemonic for this, as we have already discussed, M4U. So that means it is having 5 branches. Now first M is medial pectoral nerve. Then we have medial root of median nerve coming from here. We can see 4M is there. Then medial cutaneous nerve of arm. So that means it is giving a cutaneous branch which will supply the skin over here towards the medial side of the arm. Same way we have a medial cutaneous nerve of forearm. Then from U we have ulnar nerve. All these nerves, they are having the root value C8 and T1. All these upper 4 nerves, they have the root value C8 and T1. The ulnar nerve, it gets a contribution from C7 also, so the root value of the ulnar nerve is C7, C8 and T1. The medial pectoral nerve, it supplies the pectoralis major muscle. The medial root, it combines with the lateral root to form the median nerve. The third and fourth branch, we have already told that it will be supplying the medial aspect of the skin over arm and forearm. When we talk about the ulnar nerve, it supplies the various flexors of the forearm. So it will be supplying the muscles of forearm and hand. In this, if you want to enumerate, you can tell that in the forearm, it is supplying the flexor muscles of the forearm, and specifically it is supplying the medial half of the flexor digitorum profundus and flexor carpi ulnaris. And when we come in the hand, it is supplying the majority of the muscles except the 3 thenar muscles and except the first and second lumbricals. So the majority of the muscles of the hand, they are supplied by the ulnar nerve. Then we come to the next cord, that is branches of the posterior cord. In the branches of the posterior cord, we have just told the mnemonic star. S is subscapular nerve. The subscapular nerve is upper subscapular and the lower subscapular nerve. Then the next we have the thoracodorsal nerve. This thoracodorsal nerve is also known as the nerve to latissimus dorsi. It is also known as nerve to latissimus dorsi. Then from A we have axillary nerve, and the last one is the radial nerve. When we talk about the root values of this, the subscapular nerve, the root value is C5, C6. The thoracodorsal nerve, root value is C6, C7, C8. For the axillary nerve, root value is C5, C6, and the radial nerve is getting contributions from all the nerve roots C5, C6, C7, C8 and T1. Now when we talk about the various muscles supplied by it, the upper subscapular nerve, it is supplying the subscapularis muscle. Supplying the subscapularis muscle. The lower one, it is also helping in supply of the subscapularis muscle, and along with that it is also supplying teres major. When we talk about the thoracodorsal nerve, as the name suggests, it is supplying latissimus dorsi. The axillary nerve, it supplies the deltoid muscle as well as teres minor. The radial nerve, it supplies the extensors of arm and forearm. It is supplying the extensors of the arm and the forearm. So this is regarding all the branches, and in this if we talk about the median nerve we have It is formed by the union of medial root and the lateral root of median nerve, and the root value of this median nerve will be again from all the nerve roots C5 to T1. And if we talk about the muscles being supplied by it, it supplies the muscles again of the forearm and the hand, but over here the muscles which are not supplied by the ulnar nerve, those will be supplied by the median nerve. The muscles of the forearm and hand. So this is regarding the formation, the various components and the branches of the brachial plexus. Next comes the clinical aspect. When we talk about the applied aspect, in the applied aspect we are having two applied aspects. First is the Erb's palsy and the next is the clump case. The Erb's palsy is specifically due to the lesion of upper trunk of the brachial plexus, and the clump case palsy is due to the lesion of the lower trunk of the brachial plexus.